Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I am your host, Shawn Needham, and I am streaming live from Moses Lake today. And I'm excited to have our resident pharmacist, I'm going to start calling her, Dr. Kourtney Sanfelice, because she's been on our show, I don't know, 3-4 times. I've been on her podcast a couple of times. I'm super excited to have her on. And she is a pharmacist, as an expert in CBD, knows way more than I do about it. And she is going to be talking about CBD and opioids, specifically how CBD can help people get off opioids. And we all know that there's an opioid epidemic, and a lot of people take opioids for pain, chronic pain. So Kourtney is going to tell us how CBD can help those patients. So Kourtney, welcome to our show.
Thank you so much for having me, Shawn. How are you today?
I am doing wonderful. And you? How are you
Doing
doing?
great.
Good. So tell us, last time, I think it was last time you were on the show, we just barely touched on CBD and opioids, and I wanted to have a complete podcast dedicated to it because it's a big, big topic and a big deal in America. So tell us, what do you know?
It is. And there's even studies being done. There was a recent study completed and basically showing how, CBD can be used and showing that it can do just as much beneficially pain-wise that opioids can, sometimes even more in some cases, without the unwanted side effects, without the dependency, without the potential for causing addiction. So it's something that it's definitely, there have been studies, there's more ongoing studies. And now that, now in the past few years, after the Farm Bill was passed in 2018, they're making these studies are becoming more and more prevalent where they're actually, doing studies with actual people and not just lab rats, and they're coming up on the up and up, showing that people have success stories. I can say that working in the pharmacy and working with clients one-on-one, I have I started, just a little background on me. I started probably about 4 years ago with the class, Let's Talk Hemp. And it was a monthly class that I held at the pharmacy. I sometimes took it out into the community at different, elderly centers or different community centers, just to kind of spread the word of CBD and all the benefits that it can be used for. And one of the main things that I see it being used for, and that I'm working one-on-one with patients, is pain. And whether it be, neuropathy, whether it be arthritis, whether it be just muscle pain after a tough workout, it's helping people. It's helping people a lot. And I can say that just even the firsthand testimonies of people saying, XYZ, I took it for this, and I know that, I have arthritis, and I am now able to, do this that I wasn't able to. I can pick my grandkids up. I can do the steps without a cane. So it's amazing that this plant has benefits on people, and it's helping people just as much as, if not more than, opioids, which is a pretty awesome thing.
Yeah. Now, so one of the problems with opioids is tolerance and addiction. Do we have any issues with CBD like that?
Not at all. CBD can be stopped and started whenever you want, and there's no withdrawal. It's not like with an opioid where if you're taking an opioid, as pharmacists, we know you can't just abruptly stop if you've been on them for, chronic pain management. So, that's something that's a problem. And what I see, which is an unfortunate situation, is, people that are in pain management, a lot of times when they're going for their monthly narcotics, they have to do a urinalysis to make sure they're not taking any illegal substances. And it's almost like a catch-22, because some patients come to me and they're like, well, I really want to try CBD for pain. I think it would help me. However, I have to do this urinalysis, and that opens up a whole nother, can of worms, because CBD can come up as a false positive on a drug screen or on a urinalysis. It does contain 0.3% or less of CBD, the type of CBD that you get over the counter. But the amount that would come up by chance is smaller than the fact of the CBD itself coming up as a false positive. So it's kind of like it's like a cyclical thing where people, can't try them that are in pain management. And it's something that can not only help with the pain, it actually helps with withdrawal symptoms, or it helps with the chronic dependency, if people are, not so much addicted, but their bodies become dependent on an opioid, it actually helps if they're tapering off to balance that out. As we know that the endocannabinoid system, which we can talk about for hours, our body's endocannabinoid system, we touched base on it the last time, it's our body's homeostasis. So it's this system in our body that's not nearly taught in enough, universities to us as clinicians, that it's, intertwined in all of our systems, and it's what creates homeostasis in our body. And it's so when you're experiencing something coming off of an opioid and you're looking for treatment of withdrawal, taking CBD can actually help throw your body back into its normal cycle and help you get off of the opioids safely without having as much symptoms of withdrawal.
So, what kind of protocol do you usually recommend for somebody that is trying to get off opioids? And not all CBD is created equal, correct?
Absolutely not at all. You definitely want to use a professional grade CBD. You want to go to your healthcare practitioner, especially when you're dealing with the type of pain that you have that you are using opioids for. You obviously have a serious condition deemed by a physician that you needed these opioids for something somewhere along the way. And, so for me, I say it's kind of like a start low and go slow, always with CBD. You want to make sure you're getting a good quality professional grade product. You want to do it under the care of a practitioner that's kind of, you can check in with and say, okay, what am I doing now? This dose is working. It's not working. How do I tweak it? There's a science and not a science to it. It's different for everybody. There's different protocols for everybody because CBD is very patient specific. So what works for you might not work for me. And, we're on the topic of opioids, but CBD can be used for anxiety and depression. It can be used for seizures. It can be used to help, Parkinson's patients. It can be used for, migraines, like all different kinds of pain. So it works, it works on all of these different conditions. So when I start people on a regimen for pain, it's more or less, it's synergistically at the point where obviously you're not going to cold turkey stop your opioids, especially if you're on higher doses and you can experience the withdrawal. So I always tell people to start kind of taking them and then to start slowly starting to back off of the opioids, kind of use the CBD as a standard dose during the day, however many times they might feel it when the pain's wearing off. That's how you know when to take another dose. It might take maybe a week to figure out how long it lasts in your system. Should I increase the dose? Should I increase the frequency? And then kind of taking it from there, again, based on the patient, what their specific needs are, and then kind of slowly coming off of the opioids. And I have, I always share this one story that, resonates with me. I was teaching a class once in the pharmacy, and she didn't even say anything. This woman didn't even say anything. She was just quiet in the class, and she had 3 different types of cancer in her body. I think she had uterine, colorectal, and another form of cancer. She was on massive opioids before she moved to Pennsylvania from Florida. Her daughter had told her to start with CBD. Mom, give it a try. And when she came to my class, little did I know, a couple months later, I took my class to a church community asked me to come and speak about CBD. And at that class, this woman was there, and I thought she looked familiar. And during the class, she stood up and she told her story. And I was like, wow, I was shocked. So she was at my class. And when she was leaving my class, she happened to talk to another person who was at the class who was experiencing something like she was. And she said, she was kind of ready to give up on her dose because she was taking it and it wasn't really helping. She was taking her opioids. She couldn't really back off any doses. The CBD wasn't helping. And I guess this gentleman kind of shared his story and was like, well, maybe perhaps getting on a professional grade supplement, maybe you're not taking the right thing. And then told her about increasing the dosage and frequency and kind of had this discussion with her. And then she basically was over by the time that class happened to a couple months later when I saw her at the church, she was pretty much off of all of her opioids with the exception of, when she was really bad, taking them as like a PRN kind of thing. But it was working and she was on a regimen. So it's funny how sometimes just tweaking a dose a little bit goes a long way, and it can really make a difference in somebody's life. She was ready to give up and be like, this is expensive. This isn't working. And, talking to somebody and kind of getting her on the right path, changed her whole trajectory. And she had a lot of pain, a lot of issues going on. And it was really special when she shared her story. It was like, wow, that's amazing.
That's a great story. So how long was she on opioids before
Year-
that?
Years. I want to say it probably was about 10 years.
Wow.
Yeah.
So, how many success stories, since you have worked with so many patients, I mean, you must have a multitude of success stories like that of getting people off opioids by using CBD.
I do. I have tons. I actually am compiling them and trying to get them into a book. I have stories of, you know, it's down to one of my more recent. I actually did a podcast with her because her story was so powerful. She had lupus and fibromyalgia, and she was on. She didn't want to take opioids. She was against it from the beginning, but she was really suffering. She was basically sofa and bed bound. She and young in her early 60s, and she was struggling, so much with this pain to the point where her husband was taking care of her. She just everything hurt. She had tried some of the non opioid type of pain relievers, like non-traditional, like she was going like the Cymbalta route, where it was trying to treat like maybe like a nerve pain or something, where they were trying to get to the bottom of something. I think they put her on 5 or 6 different medications, and then she was getting side effects. She said, I literally was becoming incontinent from one of her medications. I don't remember which one. It might have even been the Cymbalta, but she was like, she washed out everything. She stopped everything she was on, and she was just dealing with the pain. And that was when she had heard about me, and she reached out. And when I tell you that I checked in on her in a week after she started, and I said, hey, how's it going? And she goes, well, I'm down the shore right now. She's like, I just walked on the boardwalk, and we're on the 5th floor, and I took the steps and not the elevator. She's like, I'm doing great. She's like, I can't believe this. This is an absolute miracle. She's like, thank you. You changed my life. This is amazing. She's become one of my regular clients, and we always check in and chat. And at Christmas time, she was like, pretty much in tears, and was like, my husband and my adult children, like, they have their mom back. They like the house looks like a Hallmark movie exploded in here. I'm able to decorate. She's like, I was able to blow the leaves out of the driveway and help my husband clean up. I haven't been able to help him or do anything. He's been taking care of me, for 7 years now, and I haven't been able to do anything productive. And it's given me my life back, which is just another one of these powerful stories where it's like jaw dropping, where people don't know if they don't know.
So, speaking of books, aren't you a author of a book just recently released on Amazon?
I am a couple of weeks ago. It became a bestseller pretty quickly. It's called Creating the Functional Medicine Revolution. And it's basically, I co-wrote it with 15 other clinicians. And we shared our stories of how we changed our own health with non-traditional medicine, and how it changed our career paths into, the non-traditional Western medicine, and how we're helping patients like I am with CBD and different functional medicine tests, and how we're all making an impact in the world with functional medicine versus where we started in our careers, going to pharmacy school or medical school or nurse practitioner school. So yes, there it is. So it's so exciting. I can't believe it grew as fast as it did. And I think so many people are really functional medicine is becoming like a common name now, and so many people are looking for help other than their traditional way, because the traditional way isn't working for so many people. Right. They get these tests from their doctors, all their labs are fine, yes, you're fine, but they don't feel fine, and they come to me after seeing 3 different specials. Well, I went to the rheumatologist and the allergist, and I'm still feeling this way. So being able to adopt these practices and help people and get to that root cause, and do it without medicine, do it with holistic lifestyle changes, nutrition, exercise, supplementation, making sure everything's in balance. People don't understand if their micronutrients and their nutrition, they're not absorbing things properly, or their minerals are out of balance. That can wreak havoc on their bodies. It can cause them to not lose weight, brain fog, migraines, just to name a few.
So, backing up, and I should ask this earlier before I got into your book, but I was so excited to talk about your book because I just, I love functional medicine, and I think it's, I think a lot of times we say the future of medicine, but really it's the past, present, and future of medicine, because it's really fixing problems instead of just treating symptoms. So, kudos to you. Congratulations on the book.
Thank you so much.
You're welcome. So speaking of the gal that was kind of going to give up on CBD because it was expensive, let's talk about pricing. I don't know much about CBD at all, so let's tell our listeners and viewers about what it would cost normally to get a month's supply of CBD.
So it's hard to kind of say because everybody's very, very
Right.
different. Actually, the woman who I just told the story about, she's like a 1 day 10 milligram dose. So for her, if she's taking 10 milligrams once a day, a $110 bottle of CBD has 100 doses in it. So that $110 could last her 100 days. If she's
Right.
having a day where she has some extra breakthrough pain, maybe she might take an extra dose. So generally speaking, usually people with chronic pain, usually anywhere from 1 to 3 times a day, they start at usually I recommend starting at a 10 milligram dose. If it's a full spectrum CBD, professional grade full spectrum is really important. Starting at that 10 milligram dose, depending on how severe that pain is, it could definitely go up to a 20 milligram dose. So really, that $110 bottle of CBD can last anywhere from, 25 days to 100 days, depending on how somebody's using it or how chronic their pain is. If it's somebody who's an opioid patient and they're using something regularly around the clock, I would say that they're probably going to maybe need it 3, maybe even on a breakthrough kind of day, like 4 times a day. So something like that might cost a bottle. They might go through a bottle in maybe 2 weeks if they're using it that much, at least until they get themselves on a regimen and get their body kind of figured out and get themselves into that homeostasis where their pain's under control off of the opioids. And then, maybe they could back down a little bit for maintenance after they get it under control. So, but generally speaking, one of the companies that I work the most with, for a bottle of the two most popular products of like concentration is a bottle that's 30 milliliters that has 60 10 milligram doses or 30 20 milligram doses, and then the larger size is the same thing, but it's a 50 milliliter bottle, so you're looking at either 100 doses or 50 doses. So it's, when you look at it in the grand scheme of things, it sounds very expensive, but when you look at the copays to the doctor's offices, the copays for the prescriptions, all of this stuff going on in the grand scheme of things, and the quality of life that you're getting back, the things you're able to do in the grand scheme of things, it's definitely affordable.
Yeah, for sure. There's a lot of hidden costs there too with, just getting your life back. Like you said about that gal that could, actually get her life back. I mean, how much is that worth for sure? So let's back up a little bit. You talked about, and we've talked about this on the show before, but I think it's something we need to address, and hopefully in the future we'll have better options. So people that want to take, and I get these people in the pharmacy, and we don't stock CBD in our pharmacy, and it's just because we focus on hormones, not because we don't believe in CBD. I'm just not really knowledgeable on it, and it's just we focus on hormones. But we get patients asking about it all the time, and they're worried about testing positive at work for marijuana through the urine test. So what do you tell patients? And is there, because I know if we do a specific test, a more specific test, they won't test positive for, the THC, which is what the active ingredient is in marijuana that makes you high. So can you expand on this and just educate us?
Sure. So there's 3 main types of CBD. So you can get like an isolate CBD, which is just where they isolate the CBD itself from a cannabis plant. So a cannabis plant has, let's just say, I'm going to round up, about 140 cannabinoids in a cannabis plant. The 2 main ones are CBD and THC. So you can get an isolate and just extract the CBD. Those products, they don't work as well. A broad spectrum CBD is when they extract the THC completely down to 0. So if you were to get you always want to get a certificate of analysis. And basically that's attached to every product, usually with a QR code where you can see exactly what's in the product, the soil it was grown in, pesticides, microbes, all that stuff. But a broad spectrum is where they extract just the THC and they leave all of the other cannabinoids, terpenes, flavonoids, all of the other things that produce, a synergistic effect. And then there's the full spectrum, and that's where you really see results. That's where, in my opinion, where I work with most of my people get the full spectrum. And then basically what that is, there's 0.3% or less of THC in there. There's no cognitive cognitive impairment whatsoever. You cannot get high. You will not get high from that amount. So my take on it is, I don't carry the THC free. It actually expired, and I never reordered it at the pharmacy because I feel like you're not really fully disclosing something to somebody. And if it's at the register, and I have one of my high school students ringing somebody out, and they see, oh, it's the THC free form, and they say, I'll be fine with a drug test. They're not. It can come up as a false positive. So I always tell people, unless they know for sure that their employer, whoever that they're at, is going to say, okay, we can take this to a lab and really dive in and pay the extra $200 to take it there. Right. Most people won't tolerate that. They won't do it for pain management. I actually, embarrassingly so, my dad was using the capsules for his sciatica. And when went to go get his little retirement job, they were like, yeah, you have THC in your urine. I was like, I'm sorry, Dad. They turned him down. My dad's like, I'm so mortified. He's like, well, my daughter's a pharmacist. She gave me these tablets. I'm like, oh my gosh. I'm so sorry. But it did come up. So it can come up as a false positive on these tests. And this was for a corporation. So some people, if it's a small business, might say, oh, okay, look, this is the product I'm using. Oh, okay, I understand why this came up. But if it's something that's a corporation, if it's like I said, pain management, they don't care. If they're doing a 7-panel urinalysis and they see it, it's like, yeah, you're hot for the THC, you're done. Yep. So it comes up as a false positive. It's more likely to come up as a false positive than it is for the THC to actually come up as a positive. So I always like to educate people on that. If there's a chance that somebody's going to do a 7-panel and there's no way that you can say to them, but I'm using this one, there's nothing in it, and they're open-minded enough to go take it and say, okay, I see where you're coming from. I always say to people, be very careful with that. I feel like the world is changing. I feel like so many states are changing their laws and restrictions with medicinal marijuana. So when that happens, it'll be easy with the CBD if they're open-minded to look and see, actually to look and look at concentrations of something and say, okay, you have this in your system, but the level's so low, it's like a blood alcohol level. It's not this amount is actually going to do anything to impair you. So we still live in a world where, people are not as open-minded. So I always caution people very strongly on that. And I actually stopped ordering the THC free form in there because I feel like it doesn't work as well as as the full spectrum. You really want to go full spectrum, but there's a fine line between that false positive and saying everything's okay. However, if it came down to a legal matter and you were fighting it tooth and nail and you were on the THC free form, the broad spectrum, you can prove in a lab it will come up 0% THC. But is somebody willing to do that? That you would have to kind of, I always caution people, look at that ahead of time. And it stinks because there's a lot of people that could benefit from it that are like, I better not. They'd rather, truck drivers with their CDLs take a Percocet prescription for pain. But if it's on a prescription from a doctor, it's okay to drive under the influence. But if you're using CBD that doesn't cause anything, well, that's wrong. So again, it's our healthcare system that's super messed up that needs to change.
Well, I think it is changing with the CBD, and hopefully they'll make inexpensive, more specific urinalysis tests, to kind of get around that issue. I'm assuming they're already in the process. Maybe they're out there, but because we can't be the only ones talking about this, because it's tragic if somebody really could be helped by CBD and that they could take CBD over Percocet, because I'd definitely rather have a truck driver on the road taking CBD than taking Percocet.
Absolutely.
Right?
Absolutely. It's crazy. I know it's and there's so many people, and a lot of them are truck drivers. A lot of people come in and they're like, I have my CDL. And as soon as they say that, I'm like, they don't mess around with that. There's very specific things with that where I'm like, if there's any chance that's your livelihood, you don't want to mess with it. And even the topicals can even strike a false positive sometimes if they're good products. Yeah. So I always, err on the side of caution. And I just say, unless somebody's you can show them the product, show them the certificate of analysis that says what's in there, and somebody's open-minded, but I think you're right, though. I think things are coming around. I think things are just coming around. Even just, I mean, I'm in Pennsylvania, so even just the way that our state has come with medicinal marijuana and the way that laws are changing, and it's becoming very easy to have a Zoom call to get a card for anxiety. And I mean, it's just so, all of these people that are driving around, working, doing their thing, that are on, medicinal marijuana. I mean, whether they're doing it on their own time, whatever, it's still in their system if they were to have to take a random drug test. So I think that there's got to be something, there's definitely something that they're probably working on, that, that there's got to be, like you said, something more specific that says, whether it's the level of exactly how much is in there, is this cognitively impairing you?
So speaking of calls, is this your website, Kourtney?
That is my website.
All right. Well, tell us about it, and tell us about booking a free consult. What if somebody has more questions about CBD?
Absolutely. So you can go on and book a connect call. We can talk and see if it's a match. If you want to go further, we can set up a consultation. We can go over products, go over specific dosing. We can talk about your drug interactions, and, just make it more on a personal level. We can absolutely set up a consultation, but you can first book a free consult to say, hey, is this a match? Is this something that you can help me with? And I also have a program on my website for clinicians as well, where I'm actually helping clinicians build their CBD business to help them, get educated, so that they in turn can educate, their patients. I was really lucky. A couple Fridays ago, I taught a class at Shenandoah University. They have actually, which was so exciting for me. They have a functional medicine elective. And my friend kind of runs the program, and she asked me to do a portion of CBD for this elective. And which is amazing, because right now, I believe the statistics are 13% of universities, for med students, pharmacy students, nurse practitioners, nurses, all of us, they're teaching 13% of universities don't even know about the endocannabinoid system or how CBD can contribute and help. So it looks like that's kind of changing too. The fact that I got to talk in front of a bunch of students was amazing, to teach them about it. Last year, pharmacy students that can bring this into their practice as well. So I think things are definitely changing, which is awesome. And, my program is to help clinicians, because if they don't know how to help their patients and to know how to dose and to get their business up and running with CBD, then, if they don't know how to educate them, then they can't help them, and in turn help the next person. So that's what I'm here for.
Well, good. And we have a question from a viewer. Can you read that, Kourtney?
Yes, my cousin has a CDL and has a lot of shoulder pain. He wants to try CBD gummies. Well, first of all, I don't recommend gummies for anything. I know a lot of people hear gummies because they're the popular thing, and you hear gummies. Not only just CBD, supplements, vitamins in general. You're kind of undoing what you're doing. There's a lot of sugar in gummies, causes a lot of inflammation, and believe it or not, that inflammation leads to a lot of gut issues, can lead to even brain fog, mental issues, depression, anxiety. So I always don't recommend gummies. I always like to have people do a tincture. It's the most pure form of CBD you're going to get. I don't like it when people try and infuse CBD with things, whether it's melatonin or turmeric. You want the most pure product that you can get, tincture that goes under the tongue. You absorb it through your mucosal membranes. You kind of bypass your liver metabolism, or at least most of it. Works quicker. You get better results. But again, with the CDL, it's would be something that I think he would want to talk to his employer about before starting, because it's if they're not open-minded about it. And I know offhand of truck drivers that are like, I haven't been tested in 30 years. I've been doing this for 30 years and haven't had a test once, which is great. But if that ever happens and you do get tested and that's your livelihood and you can lose that, I always say double check with them first. But a tincture sounds like it would be awesome for shoulder pain. Probably a topical and an oral CBD would be amazing for shoulder pain.
His cousin is self-employed.
Oh, okay. So does he ever if he ever gets random drug screens from, I don't know where he would get them from. So
I don't either.
I would
That's
say,
a good question, though.
I would say go for it. If he works for himself and nobody's checking him or testing him, I would say go for it.
Kourtney, always a pleasure to have you on. I'm sure we'll have you on again. I really appreciate you sharing your knowledge and just educating and empowering patients to take charge of their own health. I really love it, Kourtney. It's always a pleasure to have you on. So thank you so much.
Thank you so much, Shawn. It was a pleasure to be here.
And speaking of functional medicine, Monday, tune in because we will have Dr. Amy Beard on again, and she is going to be talking about gut health. Kourtney mentioned a little bit about gut health when she was talking about the gummies, and gut health it's everything. So do not miss out. You want to know more about functional medicine and how to fix problems instead of just treat symptoms? Listen in 12:30 to 1:30 Health Solutions with Shawn and Janet Needham. Monday, Dr. Amy Beard. Thank you for tuning in as always, and we appreciate your listeners and viewers. Subscribe to the Moses Lake Professional Pharmacy YouTube channel so you don't miss any episodes. Thank you for tuning in.